Thank you, everyone. We'll get started this afternoon. Welcome to our provincial update on the COVID event response for the province of Saskatchewan for Tuesday, September 13th. Please note that in accordance with the spokesperson guidance during the election writ period, the Chief Medical Health Officer will provide only technical or factual information and will not participate in the debate of programs, policy rationale, or defensive programs as promoted during the course of the election. Today we have Dr. Saqib Shahab, Chief Medical Health Officer for the province of Saskatchewan. I'm afraid we do not have the SHA with us, so we will take point on any questions for them and follow up. Dr. Shahab will have a brief statement, and then we'll go into 30 minutes of questions. For the media joining us, we have quite a few people on the line, so for today we'll take one question and then proceed to go see what kind of time we have and go to a second if that availability exists. Thank you. Dr. Shahab, would you like to begin?
Thank you, Karen. So good afternoon, everyone. First of all, I'd like to start by offering my deepest condolences to the friends and family of the resident who passed away this weekend as a result of COVID-19. So this is a stark reminder that there are serious consequences to this virus, and all of us must consider those who are most vulnerable in our province. In this instance, the individual was in the 60 to 69 age range and was from the Saskatoon zone. I'm here today because we have seen a dramatic increase in the number of cases in the province this weekend, 140 new cases reported since Friday. While community transmission has been relatively low in Saskatchewan, we are seeing how quickly and easily this can change. Cases from early in the pandemic were largely linked to international travel. As international travel decreased, transmission shifted to interprovincial travel and then increasingly to gatherings. Gatherings are now increasing as a risk as the weather cools. Cases with contact to a known case or mass gathering are increasing from 53% in the first week of October to 70% this past week. Public health contact investigations are also having a harder time confirming the source of transmission because of the larger numbers of contacts that people are having. And COVID is now being transmitted province-wide. For example, just today, 9 cases were from the north, 8 from Saskatoon, 4 from the central area, and 11 from the Regina area. And if you look at our detailed geographies, there's a case or two in almost every part of the province. So this is why it's essential that all residents must increase their vigilance and adhere to public health orders and guidelines in all settings. We will be amending the public health order effective Friday to reduce the number of people who may attend private gatherings in private households to a maximum of 15. This will not, at the current time, impact restaurants, licensed establishments and banquet halls, weddings, funerals, or religious gatherings, which are required to follow seating and physical distancing guidelines as described in the reopen plan. Wherever possible, make your immediate household your only regular close contacts. And we have to be clear that 15 is the maximum for a private gathering in a private home, but try to keep to as many people as possible in your extended household. 2 to 3 households, 2 to 3 close friends. Whenever outside your home, when potentially having contact with anyone who is not a household member or a member of your extended household, please wear a mask. Have conversations with your extended household to make sure you all understand the concept and are adhering to public health advice. No one should feel uncomfortable asking these important questions. Community transmission means our provincial risk warrants mask use in public places, especially where you cannot maintain physical distancing reliably. Further reducing gatherings is an additional step we can take right now. Along with masking, this can help us keep our case numbers low. These are small steps that all of us can and should take to help ensure that our businesses remain open, our schools continue, and other activities that promote health and wellness continue. These public health measures work. We have demonstrated that they work as a province. The vast majority of residents have been following these guidelines, and I would again like to acknowledge the efforts we have all done to keep our case numbers low. Thank you.
Thank you, Dr. Shahab. We have 30 minutes now for questions. Mark?
Yes, Dr. Shahab, how concerned are you that we are seeing transmission province-wide. And does this indicate that we're into a second wave with the province here?
Yeah, so we are seeing two definite trends. One, of course, is that we are seeing, unfortunately, mass transmission events, and that can have significant implications. So, for example, a mass transmission event with 10 cases, 15 cases, which we've seen 3 or 4 times in the past month, can generate 300 to 400 contacts and an additional 15, 20 additional cases. So we're seeing that, but we're also seeing a consistent increase in person-to-person transmission, not linked to a large event, but linked to those small, intimate gatherings that we have all the time. And that's why we have to address both. We obviously need to be very cautious about any gathering, but also on our day-to-day behaviors, we need to re-establish, what we've been doing so well, but maybe just relook at, okay, are we making sure that we are wearing a mask in an indoor public space? Are we maintaining that 2-meter distance? Many people have been to work, and in hindsight, they really shouldn't have gone, because later on, as symptoms became worse, they tested positive. So, even if you have a slight cough, which is new, and a headache and aches and pains, don't go to work, stay home till your symptoms are better. And if they continue for a day or two, seek testing. I think those are steps that most of us have been doing, but we just need to redouble our attention to these measures.
Thank you. Moderator, do we have a caller on the line?
We have Carol Thompson with CJWW.
Hi. My question is about the cutting down on the family gatherings. It seems like public gatherings may be the issue, so why are we cutting down on the family gatherings?
I think we have to look at all aspects. So certainly the guidelines for receptions where food is served are 30, and they remain at 30. But even there, you have to make sure that if you're having an event at a public venue, there should be enough space. 30 in a small public venue is not appropriate. 30 where you can't physical distance, where you have a buffet, is not allowed and not appropriate. 30 can happen in a way that there's static seating, there's plated food. You don't attend or host if you're unwell. But in the home setting, I've said many times that it is very hard to physically distance 4 people in an average room, let alone 15. So whenever we are having an event with our extended household, we also need to think through that, because some transmission is happening in larger public gatherings. Some is actually happening in a household, even within extended household. So that's again an area that we again need to pay specific attention to as well.
Thank you. Moderator, the next caller, please.
We have Zach Rosera with the Star Phoenix.
Hi, Dr. Shahab. I think many people in Saskatchewan have gotten to the point where we've seen cases go up and down a few times now. What is different about this latest increase in cases that necessitates curbing down our gatherings, and how would you explain that to listeners and to the province?
Yeah, I think there's 3 important factors. One is that, for about a month now, more than a month now, we've had schools reopen, and that's a sector which we knew that as they open, that's another large part of the population that's out. And again, people are back at work, are out and about, and we've seen the average number of contacts that each case has that going up. So that, again, is something that we need to look at. Secondly, we've obviously been watching very closely what's happening through the rest of Canada, and cases have been going up, not so much in Saskatchewan so far, but certainly in other parts of Canada, and many reasons for that, but that's again something that will impact us because we do have interprovincial travel. And thirdly, we are seeing 2 trends which are significant. One is that we are seeing transmission linked to gatherings, more than half of our cases in the recent week or so, but we are also seeing sporadic cases where people can't really identify their exposure, and they haven't really been anywhere, they haven't been to a larger event, they haven't been close to someone who was COVID positive or was sick, but then they are COVID positive. What that means also is that, especially as we move indoors, we're not outdoors as much as we were in the summer. As we move indoors, we just need to pay attention to all the things, staying home if you're sick, when you're going out, maintain that physical distance as much as you can, wear a mask in an indoor public place, wash your hands before and after going out. And I think paying attention to that is going to be essential as well. we have heard anecdotally that people who are going to get personal care services, a customer wasn't wearing a mask. That's not fair to the person providing you a service, or the provider was not wearing a mask. So I think, everyone was very diligent in April, May. I think there's a bit of a relaxation in the summer, but that was fine because our case numbers were low. We could be outdoors more. Now is the time to kind of, really pay attention again to these basic principles.
Thank you. Moderator, our next caller, please.
We have Laura Woodward with CTV.
Hi there. I'm just following up about an incident that happened at a Saskatoon nightclub. The owners of Diva's nightclub, where a video was taken showing a packed dance floor, said that they are going above and beyond to adhere to provincial guidelines, but that once people get inside the bar, they can't control every move they make, and the business is still at mercy of the actions of their guests. Do you agree with that, and what is your response to that nightclub?
Yeah, regarding a specific venue, public health does investigate any credible reports of an issue, which in this situation is continuing to be investigated, and appropriate actions will be taken. But I think the other part of the question is really important, that business owners, venue owners have to do their part to make sure guidelines are followed, and for the most part they are complying. Not in every circumstance, but in most part. But absolutely, if people are attending a private gathering at someone's home, even a family member's home, we need to do our part. If you're going out to a restaurant or a bar, we all need to do our part. And there's no point having a discussion with the owner about not complying with the guidelines. Wearing a mask in an indoor public place is really important now. And so I think we all have a role to play.
Thanks. Moderator, next call, please.
We have Guy Quenville with CBC.
Hi, thanks again for your time. There's been a lot of messaging in the province's daily releases lately. Stay home if sick, they say. Is that because you're seeing increased evidence of COVID positive people not staying home and going to public places like work, Dr. Shahab?
Yeah. I think, in the past, we've always known about people being heroic and showing up sick to work, and we just can't afford that. And I think for the most part, people are not ill-intentioned. It's just, people have a strong work ethic. They just want to be there, either at work or to that special event. And in hindsight, people realize, what, I was feeling achy that morning. It didn't feel right, but I thought I'll go to work or I'll go to that event. And then a day or two later, I got a cough and a fever, got tested COVID positive. So I think we just need to pay more attention to how we're feeling, staying home. Employers need to accommodate us, and they've been doing a great job so far. But it is a year where we will all have disruptions where we're not feeling 100% and shouldn't go to work, and employers need to accommodate that. Same with schools. Children and staff need to stay home when they're unwell. And, I've said in the past that this school year, children will miss many weeks because they have had a cough or cold, and they stayed home till they were better or got tested. So it is going to be a different year in that sense.
Thank you. Moderator, next call, please.
We have Stephanie Taylor with the Canadian Press.
Dr. Shahab, why are we not seeing any kind of gathering size limits reduced for, say, nightclubs, bars, even restaurants, or some kind of new restrictions put in place for public gatherings when those have been a large source of recent infections, not just in private homes, but in public places? So why are kind of nightclubs and other public spaces left off of the list for today?
So we're monitoring several things very closely. One is we are monitoring our case numbers. So at the moment, they're around 3 to 4 per 100,000 in terms of daily case numbers. But we're also looking at the average trend line, and that has been trending up. We're also looking at transmission settings, and some of the transmission has happened in large gatherings or poorly organized gatherings. So that's obviously a concern, and that's where there can be some further actions, including fines. We also realize that while nothing is 100% safe, we have seen that for the most part, restaurants, bars, gyms, have been, place of worship, have not resulted in large transmission events. But when there is a transmission event, there's always public health follow-up that, manages to control that, but not till there's, maybe a further 2 or 3 chains of transmission. Usually, by the time it's under control, most of the new cases are just contacts of a household case. So I think we have to look at all these aspects, and obviously we have to protect the most vulnerable settings, long-term care and personal care homes, healthcare facilities. So we're looking at all these perspectives, and at this point, the two most important things we can do is pay attention to the basics, including mask use in indoor public places, staying home if you're unwell, maintaining that physical distance. And, our gatherings in the home, we're hearing, many times people get together for a birthday party, for other special occasions. It's crowded. You just can't fit 30 people inside a house, and that's where we need to focus on. But beyond that, obviously, when you're out and about, going to a restaurant or bar, follow the guidelines. It may sound counterintuitive going to a bar, restaurant with a mask on, but keep a mask on while you're chatting. Take it off to have, your drink or your meal. Put it on if you want to linger for a bit. All it does is that's an additional layer that is source reduction. It prevents you spraying, droplets and viruses all over the place. So, every little bit counts, and that's where we want to focus on.
Thank you. Moderator, our next call, please.
We have Laura Sharpaletti with CBC.
Hi, Dr. Shahab. Thank you so much for your time. In light of the recent outbreak and the concerning rise in cases, why don't you go beyond the current strong recommendation for indoor masking and actually make it law that people have to wear masks in indoor public spaces? And does your seeming resistance to do so have anything to do with the fact that there's an election going on right now?
I think just a few provinces have got a provincial mask policy. We've looked at all those perspectives. I think at the end of the day, it is our, at this point, I would say it's all of our responsibility to wear a mask in a public place. Obviously, if stronger measures are required, they would be considered. But, maintaining that physical distance, putting a mask on in a public place, washing hands, staying home if you're unwell, these are really things all of us have to do ourselves. And I think the more we comply with this, the more an impact we'll have. So I think we really need to, anecdotally, I think, I see more mask use happening in all kinds of public places. And so we are trending in the right direction. But I think we need to be consistent. We need most people, if not all people, to do that. But we need to monitor how that impacts transmission.
Thank you. Moderator, next question.
We have Britton Gray with CJME.
Hi, Dr. Shahab. I'm just wondering, when it comes to policing these new restrictions, how effective do you think it will be? And do you think fines are kind of enough to do it? Because this will be now the second time that we're kind of going into a little bit more restrictions here.
Yeah, I would really sincerely hope that, we all comply with, the gathering limits of our households. No one wants to, report on your neighbor. And certainly, again, we'll see how Thanksgiving went, but anecdotally from what I saw was people were being very careful and judicious with how big Thanksgiving events were. But I think we just need to comply with this. And, this is the week when the weather is cooling, and so we just need to be extra cautious. We've had multiple transmissions in birthday parties, unfortunately at funerals and wakes, all kinds of settings where, no one wants a transmission to happen. People go. In hindsight, sometimes people weren't feeling 100%. Sometimes everyone is feeling fine, but we know that 30 to 40% of people who are infectious are asymptomatic. So we just all need to do our part, maybe reduce our gathering sizes in homes, which are very common. Many people may choose to have a gathering every now and then. We just need to reduce them, few consistent households, 2 or 3 households, 2 or 3 close friends, the same friends, and obviously monitor that.
Moderator, the next call, please.
We have Caitlin Wilson with Global.
Hi. What can you tell us about a fine that was handed out for noncompliance in connection with the Prince Albert Full Gospel Outreach Center?
So I won't comment on the specifics of fines and enforcement activities, but we need to ensure that if there was non-compliance with either the guidelines for place of worship or receptions, it should result, unfortunately, in further action, which could include a warning letter or a fine, and the fines can be significant, up to $2,000 for individuals, up to $10,000 for business or higher. So I think, but the fine really is the last step. I think in most cases we should not even wait for it to get to that. And in the vast majority of cases, when you look at places of worship, when we look at other settings, people have been very cautious, judicious, complying with the guidelines, being very careful around each other, and that's been shown in our numbers. But we, with fall coming, with the weather cooling down, with our case numbers rising, we just need to pay more attention to those everyday things we've been doing.
Thank you. We'll return to the room. Mark, you have a second question?
With cases rising here as well as provinces around us, how confident are you that we can get this under control? Because every other time it's been isolated incidents, and this seems to be more province-wide.
Yeah, I think most parts of the world are showing an upward trend, and so certainly in the Northern Hemisphere, we always knew that fall would be more challenging. So Europe, North America, all jurisdictions are showing an upward trend. I think we have done really well so far, and we need to do everything we can to keep our numbers as low as possible. They may not remain as low as they were towards the end of the summer, and we'll see sporadic outbreaks and clusters. We have to do our part, and we'll certainly keep monitoring. We really need to do what we can to make sure that schools remain open, businesses remain open. We can enjoy the things that we can enjoy, but also keep our numbers low.
Thank you, Doctor. Moderator, return to the call list.
Going back to the top of the list with Carol Thompson at CJWW.
Okay, this is sort of off the topic we've been talking about today, more on the federal government is working with the provinces, the Prime Minister said today, to get those COVID-19 rapid test kits to the front line. So I'm wondering if you have any information on when we could maybe see those in Saskatchewan, and maybe what the test kits are like. What are they about? Is it a single piece of equipment, or how does it work?
Yeah, so I'll just give you some initial responses, but there's active engagement by the Saskatchewan Health Authority, the provincial lab, and our partners in the federal government, by the provincial government as well. And basically, we have had a strong and robust testing platform that's primarily PCR based, where swabs either have to be sent to a centralized lab in Regina or Saskatoon, or there are multiple sites with gene expert machines where testing can be done more rapidly locally. And now there's 2 other platforms that are going to be available within a few weeks that will be deployed in Saskatchewan, just like many other jurisdictions. One is a more rapid point-of-care PCR type platform, and the other is a rapid point-of-care type antigen test platform. So I think this is all good news. It'll enable us to do more testing with shorter turnaround times, and we will be on track to deploy those platforms just like other provinces over the next few weeks. But at this point, they are still in the planning stage, and we'll be sharing more information as we are closer to these additional testing platforms being deployed.
Thank you. Moderator, next caller, please.
We have Zach Becerra with the Star Phoenix.
Hi, Dr. Shahab. I'm wondering what you can tell us about some of the recent cases reported in Regina that were reportedly linked to an apartment building.
Sorry, could you just read I missed the first part of the question.
Sure. I'm wondering what you can tell us about some of the recent COVID-19 cases reported in Regina. One of the news releases over the weekend said that many of those cases were linked to a single apartment complex or building. Yeah,
so at this point, there were just 3 units out of a larger group of under 30 units where there was an initial case and then some secondary transmission in the household. Some possible linkages among 2 units, but not the third. But again, this is just a caution that sometimes we can describe the transmission because everyone went to a specific location. Sometimes we can't. And the way that we can keep transmission risk low is by what we've been doing all the time. We know what to do in a retail environment, but what it means for a large apartment complex is, as you're coming back to your apartment, putting that mask on as you enter from a common door, and if you're using the elevator and a stairwell, keeping a mask on. We do that at work. We should do it in our residential apartment building. Similarly, if you're going to a laundry room, again, washing your hands before going. There's good guidelines on how to use common laundry, not shaking your clothes out, but using the laundry, sanitizing your hands before and after using the laundry, having a mask on, as you're chatting with your friends and neighbors in the laundry room, keeping that 2-meter distance, having that mask on. I think sometimes when we are at places where we are familiar with, whether it's a workplace or an apartment building, we're not always aware of using these simple precautions, and I think this is a reminder that we absolutely should.
Thank you. Moderator, next call, please.
We have Laura Woodward from CTV.
Dr. Shahab, I'm wondering if you can definitively say whether we are or not in a second wave and what indicators would dictate when we are.
So we are seeing an upward trend. More than 50% of that trend is explained by large transmission events. So, but we are, the 40% or so cases, we are seeing an upward trend of cases with no known exposure. So we are definitely seeing an upward trend. What trajectory that will take, will it kind of rise and then level off with some additional measures that we are announcing today, is one option that it's up to all of us to see if that happens. Will it continue to rise very slowly and then level off at a higher level? I think that's another potential that can happen. I certainly hope it won't see an exponential increase that some other jurisdictions have seen, but we have to monitor on a week-by-week basis.
Thank you. Moderator, next call, please.
We have Guy Quenville with CBC.
Thank you. Last week, the Saskatchewan Health Authority announced that it was going to require everybody, staff and members of the public, to wear masks while inside Saskatoon health centers. And I probably wasn't the only one in the province who thought to themselves, wait, that isn't already policy? So I want to ask you, Dr. Shahab, why wasn't it already policy to have universal masking at Saskatoon health facilities? And does this mean that everywhere else in Saskatchewan, except for Saskatoon, doesn't currently have a universal masking policy at health centers?
Yeah, so I'll maybe ask the Saskatchewan Health Authority next time they're on to give more details. But I'll just talk about some basic principles. So in the healthcare environment, as well as in personal care services, you obviously need to wear masks when you're providing care. So in a healthcare environment, you need to use PPE. When you're having personal care services like a haircut, both you as a customer and the provider should wear a reusable cloth mask. So that's when you're closer than 2 meters for providing service, whether it's healthcare or personal care. But then we also have seen transmission in workplaces that are not happening when you're providing healthcare or personal care. It's people working in other parts of an organization, whether it's healthcare or other parts, where we've seen outbreaks in workplaces. So this is just a reminder that even in healthcare, when you're maybe working at other parts of the organization that's not direct patient care, you obviously also have to practice social distancing, physical distancing with your colleagues, and wear a reusable mask, not a medical mask, a reusable mask in those settings. And that's just a reminder to that we need to do that, whether we work in healthcare, whether we work in any other workplace. And again, just like in our social interactions, a lot of the transmissions happen not necessarily when you're working, but when you're maybe closer to your colleagues at breaks, and I think we just need to pay attention to those aspects as well.
Thank you. Moderator, next caller, please.
We have Laura Sharpaletti with CBC.
Hi, Dr. Shahab. Why were no details provided about the 25th death over the weekend, and what can you tell us about it?
So, again, every death, every hospitalization is a reminder why we all need to do our part to keep COVID numbers low. And, we did announce the 25th death once we had the requisite information. And again, I express my condolences for this 25th death, which, as I mentioned earlier, was in a person in 60 to 69 age group from the Saskatoon zone. But I have to say that so far we have been fortunate, and staff who have worked in long-term care facilities, personal care homes, hospitals have done an excellent job of preventing COVID introduction to those facilities and preventing large outbreaks. Having said that, we have seen devastating outbreaks in long-term care facilities, personal care homes, hospitals in other parts of the country and the world. And we need to continue to, keep our numbers low, be extra cautious when we're visiting friends and family in healthcare facilities or long-term care facilities, go through the health screening. And I think this is just something that is so important because unfortunately, if you look nationally, the vast majority of deaths, including in Saskatchewan, have happened in people who are more vulnerable, older, or with underlying risk factors.
Thank you. Next caller, please.
We have Britton Gray from CJME.
Thank you. Dr. Shahab, I'm just wondering with these new restrictions in place, kind of with the rise in cases, what this might mean for the future of, say, like hockey and sports that we're trying to get underway here, WHL expected in December, what this might spell for their future here.
I think we'll have to monitor the case numbers. What we have seen with organized sports is that with the guidelines for the mini leagues where you have a limited number of either children or adults playing in mini leagues locally, we have not seen large transmission events. But again, I think all of us as athletes, children, adults, staff, coaches need to do our part, not go to play that really important game if you're unwell, and screen children as they come, just like in school, and keep children home if they're unwell. But we will need to keep monitoring. You can have, school sports safely. You will see occasional cases, maybe small clusters, which will need to be managed. We will need to monitor. And again, a well-managed league is one thing. A league that's chaotic, where people aren't being supervised, they're mingling, not during play there may be some contact, but while you're on the bench, if as long as team members aren't mingling within a team or across teams, I think those are things that can result in transmission events, not just the act of actually playing in a sport. So I think those are the things that there are clear guidelines for, and as long as they're managed, we hope that will not be a problem. But obviously, we'll need to monitor those things closely.
Thank you. Moderator, did our last caller stay on the line for one more question?
Yes, we have Caitlin Wilson with Global.
Hi, I just wanted to follow up to a previous question just regarding the videos we've seen with the packed dance floor in Saskatoon. Now, more videos have been surfacing and sent to us recently with another nightclub in Regina, similar situation. And this is twice now that we've received a response from the owner saying that they can't control what people do in the nightclub. In that case, should nightclubs still be allowed to operate given what we are seeing, or is something being done to monitor these later hour gatherings?
Yeah, I don't have the details, especially about the second event, but I think that's a fair point, that if certain venues can't maintain physical distancing and follow guidelines, I think then that is a high risk for transmission, and obviously there'll need to be specific follow-up for those sites as well. And I know in other jurisdictions, for bars, hours have been reduced, how bars operate have been reduced, that you really should sit at your table and have your drink served. Music has been reduced so that people don't have to lean into each other. And again, as I said before, if you're sitting for an hour, not having a drink or a meal the whole time that you're there, it makes sense, in my view, if you're not with your immediate household, to wear a mask. And also for people around you, wearing a mask reduces transmission events. And the more time you keep a mask on in a public place, the better it is for everyone.
Thank you, everyone. That is our update for today. Please be watchful. We'll set an advisory for our next availability. Thank you this afternoon, Dr. Shahab. We'll speak with you, everyone, again.